And again, people with diabetes are at increased risk for serious gum disease because they are generally more susceptible. So they have the bacterial input into the oral environment, and they have a decreased ability to fight bacteria. So they are not able to fight it as well as someone who may not have diabetes. Other possible mechanisms: altered host response, changes in the connective tissue we might see, and then changes in the gingival-crevicular fluid, the fluid around the gingiva, small changes to the blood vessels around the gingiva. Also subgingival microflora, which is bacteria under the gum, and hereditary predisposition. We know that there is a large hereditary component to diabetes, especially type 2. And then other issues, common health issues, foot conditions. The patient may come and say they have numbness in their feet. They may say they have skin conditions, itching a lot. They may have musculoskeletal conditions and diabetic foot ulcers. And then eye conditions as well, double vision, cataracts, etc., macular edema. So lots of other things that we can also ask as dental professionals, those who are here as dental professionals, ask our patients. We're not only dealing with the mouth, but we're dealing with the entire system. Human body, everything is connected together. So we need to ask those questions. Complications of diabetes mellitus, retinopathy, nephropathy, neuropathy, and the thing that is striking here is that Harold Lowe, in 1993, listed the 6th complication of diabetes as periodontal disease. He saw that at that time. And along with the American Diabetes Association, they have recognized that periodontal disease is common in patients with diabetes.